Our keynote program for you here today, which is a conversation on leadership, on the future of healthcare in Hawaii, and what challenges, opportunities for disruption, and opportunities for reform exist here in 2019 and beyond. Conversation with President and CEO of HMSA, Mike Stollar, and President and CEO of HPH, Hawaii Pacific Health, Ray Vara. Let's give them a round of applause and welcome them to the stage. Thanks for coming, gentlemen. And as they know, some of you will recall, we had them on a breakout session last year, and these two gentlemen said, you know, nobody really wants to hear from us, like we're administrative types, and the room was packed. So gentlemen, thank you for joining us. Appreciate you being here.
Glad to be here.
Mike, let me ask you first, just a general question to start things off. What are the sorts of things that you're keeping your eye on as you look out to 2019 and see some of these opportunities for reform, opportunities for disruption, and the general interface between the marketplace, meaning the private sector, and public policymakers? What are the things that you are spending mental energy on?
I think the answer is what are we not focused on spending, starting at the federal level, just trying to interpret what's going on, what's potentially coming. Things seem to change. Court rulings one day, overruled the next day, and it's hard to know exactly how that's all going to unfold. And then, of course, coming at the state level, everything from the Medicaid RFP is out there, and trying to understand what that is and where we play in that, down to our relationships with our payers, with our provider systems, and trying to make sure that we're working as well as we can in those areas. And then, watching all the innovation, all the disruption going on, and trying to figure out where that plays, and how we really can keep the system as a whole working here and not fragment, which doesn't help anybody and really adds cost and burden.
Yeah, let me just sort of ask you the same question, Ray, to start, about the things that you're spending your mental energy on. And the reason I like to ask this question is because there are so many things that can distract us or which are also important. So I'm wondering, what do you allocate priority to when it comes to attention?
Yeah, so we get asked this question quite a bit, and maybe I'm back this year because I didn't get it right last year, but quite frankly, while we have, given the size of our organization at Hawaii Pacific Health and the scale and the scope of the work we do, we obviously have to be involved in policy and policy making. But frankly, we spend very little time from a leadership standpoint worrying about that. And the reason being is I think, frankly, that's what's created some drag in this country and certainly in our industry, is that we spend time worrying about what the policymakers are going to do versus actually leading that change. Frankly, I know HMSA knows where we need to go from a reform standpoint. I believe Hawaii Pacific Health knows where we need to go, and I think as leaders, we need to focus on driving those agendas forward versus worrying how someone else outside of our industry is going to lead that effort. And truth be told, I mean, I saw in your video, the announcement of Amazon, JP Morgan, Berkshire Hathaway. Frankly, that should have been a notice to all of us in healthcare that those outside of healthcare have lost confidence that we're going to deliver the kind of change in the time frame in which we need to change that they're looking for. And so it really should be a call to action to us as leaders to actually do what we know needs to happen in terms of reforming healthcare, certainly in Hawaii, if not across the country.
So Ray, what do you think organizationally is a bigger threat to the status quo, either from a constructive or destructive way? Is it maybe well-intentioned, but sometimes not optimally informed policymaking at the federal or state level? Or is it the sort of Huns at the gate of technology organizations that think that they can bring solutions to disrupt healthcare?
Well, I could talk a little bit about each without opining on which better or worse. I do fear when We have those who aren't involved in healthcare, whether it's policymakers or otherwise, getting involved in driving policy. That being said, from a policy standpoint, the reason we don't spend a lot of energy as leaders in Hawaii Pacific Health worrying about it is because we're always adjusting to policy, and we know the constraints of what we can impact and what we can't impact. And one of the things that we're pretty good at is, once we've set our course, adjusting as necessary based on policy. And so that's a position we're very comfortable in. As it relates to folks like Amazon or Walmart or JP Morgan or any of those guys getting involved in healthcare, I actually think it's a good stimulus for us. Because look, these folks know what the challenges are that face this country in terms of the burden that healthcare places on our country and the people across this country. And it's a good stimulus for us to take action. Because if we don't, I'm certain they will. They have the resources, they certainly have the brains, and they have the mindset to move it forward at a much quicker clip than we've been willing to do. And so again, I think it's actually a really good thing, because if we respond appropriately as leaders and own our industry, own our environment, as we should, as those who should be the most informed about what needs to happen.
So Mike, building off Ray's comment, do you think that, historically the healthcare sector has not moved towards innovation very quickly. I think HMSA and the providers here have distinguished themselves in the country as being innovative and innovators. But it seems like technology moves a lot more quickly than the healthcare sector. I don't think that's an overstatement. I also think that with looming RFPs for Medicaid procurement, that can be significantly disruptive. Do you think that the healthcare sector is doing enough to stay in front of these threats and responding, as Ray is suggesting, by being motivated, or are there opportunities for improvement?
I think we're all doing what we can, and we're trying to figure it out how to do it together. And I think ultimately here in Hawaii, our relationships and our focus on the things I think we all know we need to do is a difference maker. And if we maintain that focus and we can work together, which I think we have a real opportunity to do here as compared to other places. I go to a lot of meetings on the mainland, and people are just shocked here that we as a payer can sit down at the same table as our provider, our major health systems, and actually talk to them about what's working, what's not working, what are the things we can focus on, how can we relieve administrative burden, address cost, quality, access, and figure those things out together, and move beyond just the transactional nature of the relationship. And it takes leadership. Ray talks about it takes trust. And we have the ability here to build off who we are, to build off trust and relationships that are unique in Hawaii, to do things that no matter what happens in the tech space, if we can work together, have that trust to do things together, we'll be okay.
Tell me, the value-based approach to payment for care that HMSA has led now for a number of years, starting with primary care and expanding. It's been, as I mentioned, in place for a number of years. What do you think that you've learned now that you're on the other side of that divide about the provider community here? How have they grown into this model, and what have you learned on the plan side?
Innovation's tough. It's tough to put into place, and if you can do it in a collaborative means, if you can plan and design together, you're going to get a lot further. And I think that was one of the unique things we tried to do in our payment transformation program, is start a year and a half early with the primary care physicians, with the health systems, and try to design. No one's claiming victory. We're claiming that we put something really different and impactful in place. We're going to have a major paper published this year, we believe, in a major journal about what took place. But the key is, as I said, no one's declaring victory. There's more we have to do. And part of that really stems from listening, about what's working, what's not working, what are the changes we have to make, how do we make it simpler and easier, and that's going to continue on, and that's a model for us all about how we implement things and then continue to work on them to make them better.
I should just say, personally, since it's just you and me and a beer, that I really appreciate HMSA's sponsorship and support of Say Reform, so thank you. And likewise, Ray, I really appreciate HPH's engagement and support. I think you guys have like 37 people here today, so thank you.
Yeah, we'll talk about that another day. Just joking, glad they're here.
Let me ask sort of the other side of that coin. What do you think hospitals or HPH or providers writ large have learned about value in Hawaii and HMSA's approach now that we're a few years into it?
Yeah, first of all, I think while HMSA, with all due credit, has delivered tremendous leadership, I think Mike would agree there's not an HMSA approach. There's an approach that we partner through together in order to position ourselves at the tip of the spear as it relates to reform. And I think that partnership and that relationship is unlike most anywhere else in the country. And so I think that works very well. From an organization standpoint, you know, we know we've seen too many organizations as they approach reform, as they approach value-based propositions, do all the right things and live every day to regret it because they didn't align themselves with a payer partner who is able to walk that road with them and find the value in the same kind of work that they're doing. But there's also a component of it that while it is hard and while we have made great progress sort of at that system level, I will tell you within Hawaii Pacific Health, we've got a lot of work to do. While we've done great things around quality, we've done great things around service, but in terms of as leaders doing more faster, quicker, over a higher bar, we've got a lot of work to do within our organization. We are asking ourselves right now, how do we think beyond the work that we've already done? How do we really dig into the details of how we make an impact in the lives of our patients? You know, look, we measure all the same quality measures that everybody else does. We look at all the same metrics, and frankly, we rank pretty darn high on a national basis. But if you look under the microscope, there's still some real gaps in terms of the way we're serving our patients and the impact of the lives we're making. If I can, I want to tell a quick story. Sure. And this is, you know, an example. You know, as we think about this moving beyond, we've also got another sort of code word for this internally called GROSS, which means getting rid of stupid stuff. We've got things going on that create burden for the people trying to deliver that care on a daily basis. And when we do that, it creates burden on our patients. So, you know, we've been doing some work with the Seattle Cancer Care Alliance about integrating population health elements into work with our cancer patients, getting into early detection and prevention and those types of things. And as we've studied that, one of the things that we found was we've got some gaps in the way that we manage end-of-life care. And what we found is that of a cohort of patients, about 192 patients who passed away within a defined period of time, during the last 30 days of their life, 80% of them had to go to the emergency room. Now, that should never happen for somebody who's at that stage of their life, who's under that kind of care, both from probably an oncologist and a primary care physician. It creates burden on the providers who are involved with getting them through the emergency room. It certainly creates congestion in the emergency room. It's a very costly approach, and most importantly, creates huge burden on our families who have to go through that. And the challenge comes with this. If we wanted to change that tomorrow, how do we make sure that no family or no individual in the last 30 days of their life when they're going through such a challenge has to go through the emergency room to get the care they need? I know within our organization, if we wanted to change that, we would committee that thing to death. I mean, we would send it to every committee who thinks they have an opinion. We would ask everybody's opinion. When I ask our organization, they say it would take 12, 18 months if we're lucky in order to get a change that actually said, we're not going to allow that to happen anymore. We're not going to make people go through the emergency room to get the care they need during that critical time of their life. And so the question we're challenging the organization in situations like this is how do we make that happen in 7 days and 14 days and remove all the barriers that we know exist today that are causing harm in a different way to our patients.
You know, Ray, that's a great point. I may steal your gross acronym from you.
Well, it was just
it's
published
everywhere.
in the New England Journal of Medicine by
Okay.
Dr. Melinda Ashton.
So
And
it's,
so it's
you know, it's
out there
everywhere,
everywhere.
and we all have to address that. And when we address things together, we just had a presentation this morning from one of our pediatric case managers about how we're actually working together to figure out discharges.
Right.
So they're timely, so they're less burdensome on the family, so the policies are adhered to, the payment is aligned, and we're getting the families the resources they need so they can get out of the hospital, so they can get to home, so the best care in the best setting is delivered. But it really takes both organizations to figure it out.
No, that's right. I mean, what's at risk is right now, if you look at the data, and you've probably all, I should have brought the slide, but I don't use slides very often. You've all seen the slide that shows that, you know, Hawaii is one of the healthiest places to live. We got the lowest cost per beneficiary served, and we have the lowest cost per beneficiary served of anywhere else in the country for Medicare patients. Our commercial insurance premiums are among the lowest in the country, and that's all a good news story when you're thinking of reform. But to me, that presents a real risk for us also, because everybody else is working to get to that same point, and if we allow ourselves to be complacent, everybody else is going to pass us by, because that is, while it's a great success story, it's also one of our greatest risks. If we don't continue to find a way to think beyond the way that, you know, we've traditionally been thinking about what quality looks like, what patient experience looks like, what true value really looks like. And that causes us to look in the mirror and look really deep in the organization. And that's exactly the kind of work that we're doing to bring value.
I don't know if you caught that there. I felt like I was sort of in a Serena versus Venus Williams tennis match where I was back and forth there for a little while. So I sort of just feel
We
like...
spend a fair amount of time in conversation.
Yeah, that's good. I sort of just feel like saying, Mike, go. What do you want to say to that?
You know, what I'll say is you've got it right. We've got to continue to pursue the value. We know that every day out in the field with our employers, the people who pay the bills, our commercial population, our government program, the people who are actually paying for these programs are constantly, we constantly feel the pressure of, is it affordable? Are we driving affordability? Are we driving quality? And you know, patient convenience is really something that's emerging. It's a real challenge for the open system. When that employee at an open enrollment, when all of you, except maybe the Kaiser members here, are at an open enrollment and have to make a decision, you know, what are the things that's going through their head? Cost is certainly a big driver, but they're thinking about, is it easy? Is it convenient? Do I have to run around town? Do I understand the billing? You know, and what are the costs involved of not only the financial costs, but the cost to my family for what I'm buying? And that's our challenge, and we're reminded of it every day, and it's pervasive.
Mm-hmm. Mike, the intersection of the social determinants and the traditional medical system and the human service community comes together at the topic of housing and homelessness. Continues to be sort of a moral stain on many of America's cities. It's particularly acute here. What do you think, as you think about housing and homelessness, what does the healthcare system writ large need to be doing more of to be able to collectively address that? Certainly the Medicaid RFP, or excuse me, the 1115 waivers heading in that direction. And while the homeless issue is relevant to Medicaid, it's not just about Medicaid. What do you think needs to be done to try to get our collective hands around that?
Well, you know, that's a huge question.
Yeah.
When you start talking homelessness and all the possibilities there. So I think, you know, by focusing on the things the healthcare system can immediately make a difference on. We have frequent flyers who show up in the emergency room, homeless people, 200, often more than that times a year. What can we do for them? How can we help them so they don't have to come into the emergency room? What are the services, whether it's the new hygiene program station that just opened up in Iwilei, what kind of healthcare needs, how do we interact and integrate with the police, with EMS, so the emergency room doesn't just become a dumping ground. How do we interact with the social service agencies? That needs to become more cohesive. People have to be able to see across the spectrum of services what's happening, and we have to get out into the field. So community health workers, we are going to have a big push on into the communities, people from those communities. We think touching people where they live, whether that's a park or in their homes, will make a big difference.
Yeah. Ray, let me ask, because I really like questions that highlight leadership and leadership styles, and everyone here is a leader in some way. They lead a program, or they lead a department, or they lead an agency or organization. And a lot of CEOs will tell me that their number one job is communication to their agency, to their organization, that they have to always be communicating. When you look internally, what are the sort of the big topics that you are trying to manage or lead on internally to your community at HPH to get the organization ready for what's coming?
Well, it's just those things. One, that it is coming. I mean, we're very outspoken the fact that we are going to be in partnership with HMSA at the tip of the spear in leading this reform effort. And the number of days that we have in front of us in this fee-for-service environment is numbered. But we also, we stay pretty laser focused on what we consider our keys to success. Delivering phenomenal patient experience, recognizing that population health is at the forefront of that, and we define population health, that while we could talk about that all day long, it's about taking what we've learned about that one individual's patient experience and figuring out, both from a quality and service standpoint, how we can apply that to the broader population. It's also about recognizing just what Mike was talking about, that given our size and scale as an organization or a combined partnership, we don't get to sit by the sidelines and let someone else worry about the education system in this state, worried about the affordable housing and homeless issues, worried about making sure that we've got a viable economy into the future, making sure that we've got food security. Frankly, organizations our size who are looking at the global health of the population have to own a piece of that and be willing to partner in the other pieces. We have to have employees who are 100% committed and passionate about serving that mission to create a healthier Hawaii. We have to make sure that the physicians who are expecting to lead that effort alongside us through this process are supported and that their well-being is cared for. It's recognizing that as that community partner, we have to find like-minded organizations as we have, whether it's with HMSA or Kamehameha Schools or Kohaniki Village or all these different organizations, and making sure that we're working alongside one another to make an impact. And we need to be mindful that if we're going to be successful at any or all of these things, we have to be able to fund our own future. We have to be good stewards of the resources we have. And so we take every opportunity to communicate that, mostly through leadership, whether it's through myself or our subordinate leadership throughout the organization, to make sure everybody knows what exactly it means when we say our mission is to create a healthier Hawaii, and just as important, what their individual role is in doing so.
So if I asked a physician like Jared Livaday or one of your team members like Michael Robinson what Ray Vara's leadership style looks like, what would they tell me?
I'm not sure I want to repeat it on stage. Oh, no. I hope, I don't know what they'd say, but I hope they would say mission driven. And we talk a lot about the mission of our organization, which, if you haven't figured it out now, is to create a healthier Hawaii. And almost every time I open my mouth within our organization or even outside our organization, it is somehow tied to delivering against that mission.
Yeah.
Well, I hope they would. That's tough. I hope they would talk about what I think is my collaborative approach, and that's all fine. But I think that I'd like to be able to say that they, it's similar to Ray. Hopefully, mission-driven. We talk a lot about purpose and what we're trying to do, and I think I appreciate this in Ray a lot, we both try to push people faster harder. Clearly, we know faster and harder than maybe the organizations are ready for. But if we don't do that, we're not getting anywhere. And it's another reason why we push hard to work together and make the staffs come together and work like that.
You've been leading a cultural change at HMSA for a few years now. What is that? Tell us about the culture of HMSA and where it's going compared to maybe where it has been.
Yeah. You know, I'll go back to the issue of relationships and trust building. And we need to be able to do that, as I mentioned earlier, with our external partners. And it takes a different kind of person, it takes a different kind of leader to be able to do that. And, you know, at HMSA, we have literally changed out our entire senior staff over the last couple of years.
Yeah.
And it was really about finding people with the capability to take those relationships on. Be purpose-driven, but understand we're not in a transactional world anymore. And we need the entire system to function together. And that means building trust, building relationships with provider systems. It means working together in ways that, you know, maybe 5 years ago were pretty strange. But that's what it takes. And so we're trying to push that. I'm trying to push that internally. And I see it similar in other organizations and certainly at HBH. They have a vision, they stick to it, they're driven, it's aligned, and so it makes it a lot easier.
It really is uncommon to have an organization, particularly one of such significant market share, such institutional legacy like a Blue Plan, turn over its entire leadership team.
So our challenge ultimately becomes, how do we get everyone else in the system to be like HPH? So we view it, you know, systemically. We just can't go off with one organization, but we need to drive that type of change. We have people on neighbor islands, we've got people in different lines of business, we've got different requirements from different employers, and they want people taken care of wherever they're at.
Yeah.
So that's our unique challenge, but we'll start where we can and with people who get it, and we'll drive that where we can.
Yeah. So I thought I'd make a joke about him inviting you to add more lines of business and grow, because he wants everyone to be like HBH. And then I thought I'd make a joke of it, and I thought, no, I should ask, like, what does the future size of HBH look like? Maybe not in terms of hospital footprint, or maybe, but what are the other things HBH will be growing into to right size for the future?
Well, so I'll answer it in a generic way and maybe get into a little details. What we've been, you know, when we go through rating agency evaluations, that really forces us to define our strategy and the way we view the world pretty clearly. What I've been telling those folks, you know, so S&P, Moody's, Fitch, those guys for years, is the way we measure size currently in their construct is wrong. We measure it right now, those of you who aren't in the acute care environment or not familiar with it, the way they measure size is based on the market share as a percentage of discharges in the community. If we're truly moving to a reform environment, we need to get past that. We need to be measuring attribution of lives whose health that we're managing within our portfolio. So whether or not we have more bricks and mortar, more hospitals, or not, will not be the metric of success for Hawaii Pacific Health. It was how many people in our community entrust our care providers to watch over and steward over their health and the health of the broader population. Mm-hmm. And so that's how we view growth. We think there's an opportunity for growth, not just for us, but frankly across the community, because we have physician shortages, we have primary care shortages within our organization. We've committed quite publicly to over a 5-year period, adding at a minimum 50 new primary care providers who are accepting patients. During that time frame, we got year 1 behind us. We've exceeded the first year goal of greater than 10. We're on track to do that this next year, and I anticipate we'll experience the similar success in the future. When you add that kind of capacity, you do need a different footprint, and so right now we're under construction for clinics at Kamakana Ali'i at about 16,000 square feet, Millennium Island Town Center at about 22,000 square feet, a little over 6,000 square feet at Ward Village, about 8,500 square feet. In Kahala Marketplace, we've got a new clinic going up on Kauai in Kapa'a. And so we've got a lot of activity going on around supporting the growth and the attribution of lives that we're going to be responsible for stewarding over their health.
You mentioned Kapa'a, and I'm wondering, how things are going at Wilcox, how things are going in Kauai, and how do the neighboring island sort of presence, how does that inform or be informed by the work here in Oahu?
Well, I think it depends. Neighbor island healthcare has a different set of challenges than we do on Oahu. I think we have been in stride with a model that works at Wilcox and the Kauai Medical Clinic probably since about 2006. We've grown the access to specialty care. We don't see, outside of those things that just don't make sense to do for a population of 60,000 plus, we try to keep people on the island as much as possible. We've continually grown the medical group there, which is where most of those physicians are housed, and it's economically sustainable. Mm-hmm. And so we've had a good experience on the neighbor islands as it relates to Kauai, where we have a full portfolio of services. We have a lot of specialty services and physician services deployed on the other neighbor islands, but neighbor island healthcare has a different set of challenges.
Yeah.
But we've found a model that works for Kauai.
Mike, same kind of question, the neighboring island versus Oahu and the...
So every island's different. Every community on the island seems to be different. We've got some amazing things happening in Hilo with the entire care delivery system and the social service agencies coming together, something called the Community Action Network. And we've been able to bring the hospital, the physicians, the FQHC, and all the social service agencies together to actually meet each other and plan together and figure out how they can interact better, how they can share information better. A lot of focus on the social determinants there. And then in West Hawaii, it's a completely wide open, nothing's really too structured over there just yet. Mm-hmm. So that's a whole different approach. Maui has its own unique challenges for us. And so we're working through all of those. And I think the key for us is respecting the differences, but trying to figure out something that works systemically.
Yeah. I want to make sure that we can pepper them with your to-the-point, intense questions now that you're fully charged with carbohydrates and protein. So if you all have questions, just raise your hand and Rita on our team will get you a microphone and we'll make sure we include those. Ray, let me ask, as people are chewing on their, not just their food, but their questions, what advice would you give to the legislature about to convene and to Governor Ige's next term in terms of health policy? What feedback or guidance would you impart to them?
I guess, look, they have a whole different set of challenges and hurdles that they've got to come over as they try to govern the state of the whole. But I think that the best guidance I could give them would be to be inclusive of leaders from our industry as they go about solving these challenges or coming together in our collective way to address all the things that they're touching as it relates to the social determinants of health. The fact is Mike and I met yesterday for lunch specifically not to talk about healthcare, but to talk about affordable housing and homelessness and how we organizationally, along with others, can make an impact in that area. And so my concern is that as we go about addressing these throughout our community, not just governmental, but also in the community, that we're working too much in silos. We've got about 7,000 people, I think, that have been identified as homeless. And on one hand, that's a large number. On the other hand, it's a number that we should be able to manage if we bring our collective resources and thinking together. And there are a lot of people in this community doing really good work trying to solve that right now, but we're not doing it together. And I think if we aggregate the thinking and the resources, we're going to have a much better outcome. And so I would just encourage the policymakers to be mindful of that and be inclusive as they go about their work.
And the business community. I mean,
Yeah.
one of the reasons for the meeting yesterday is we knew of 4 or 5 different major efforts by the business community and their organizations to address homelessness, healthcare, that intersection, and they were about to splinter. I mean, all these projects were about to splinter off.
Yeah.
And kudos to Bob Harrison to see that and really bring these things together and say, how can we solve this?
And Dwayne Creaser.
Yeah, so how do we do this? And how do we not splinter?
If you have a question, go ahead and raise your hand. Rita can walk over to you while people are getting their courage up. Let me ask you the same question, Mike. What advice would you give to the legislature or to Governor Ige in his next term?
Well, I appreciate Ray's words about collaboration and involving us. And it's pretty simple. We're focused on affordability, quality, access, and that should be the lens through which anything that's being developed needs to be put through.
Mm-hmm. Let me ask this it's a political question, and so I don't think you guys. It doesn't say political genius per se on your business card, but you've got to have some political acumen to get to where you are. If this seems like a moment in our national politics where Medicare for All is sort of, it is becoming like it's almost its time on the left. Like it's becoming a real thing. And that means a lot of different things. It can take a lot of different shapes in terms of actual policy. Would it be a good idea if the nation looked to Hawaii's sort of employer-based mandate and the model here, called that Medicare for All or some sort of universal coverage? Maybe it's commercial for all. Ray, do you think it would be a good idea for A, the rest of the country to follow this lead, and B, the rest of the country to really dig in and look at what's happening in Hawaii? Or is it better to just sort of stay out of the spotlight?
No, I certainly don't think it's better to stay out in the spotlight. Like, our vision statement of Hawaii Pacific Health is to be the leader in healthcare transformation. And I've been very clear that that does not mean the leader in Hawaii, because I think because of the innovative thinking of our health plans like HMSA, because of the employer mandate, because of the success that we've had in terms of already creating a fair amount of value in a system that is not designed to create value, a fee-for-service environment, we've done pretty well. And so I actually would like folks to look at what's going on in Hawaii, how we've delivered those outcomes, and what we have and what they have to learn. And frankly, I think the greatest way to shine the light on that is for the work that we're doing together to be successful, for us to truly bridge the gap between fee-for-service to value in a way that keeps healthcare services sustainable in the long term. And so I think in terms of the brightness of that light, there's going to be a lot said about Hawaii over the next 3 years if it moves at the pace in which I would like to see, and I think Mike would like to see it move at.
Mike, what do you think? Is there a solution here in Hawaii for the national momentum behind Medicare for All, or is it just fundamentally different, even if we call it sort of same?
So there's, as I understand it, there's about 75 flavors of Medicare for All, so it really depends what you're talking about.
Yeah.
But there is something in our story, and I spent a lot of time on the mainland talking about our story, and I don't mean the HMSA story, I mean the Hawaii story and what makes this place special. So yeah, I think there's a lot of lessons, a lot of things people could take away. I think they very much struggle to figure out how they can take what we have, though, and make it work.
Yeah.
I mean, they're still very focused on transactional relationships.
Yeah. Yeah. Questions from you all? Rita, do I see you out there? No? You guys are answering all of their questions. I guess you were right. We've done it.
On a curve.
We're done. Yeah. Like healthcare solved.
That means we're not back next year.
Yeah.
So, Ray, what advice would you give these guys? I mean, the 37 of them or so that work for you or with you, but also the other folks who are competing against you, who are collaborating with you, who are involved in healthcare in Hawaii. What advice do you give folks in the broader community when they're looking out at 2019 and saying, this ain't for the faint of heart.
Be proud of that. Like, we are intentionally positioning ourselves at the tip of the spear, as I said earlier. That gives us, certainly within Hawaii Pacific Health, through our partnership, and frankly, I think on a statewide basis, the ability to be much more nimble to adjust course as we navigate our way through transformation. If we wait for somebody else to figure it out, if we wait to be governed or policy through that change, we won't have the same ability to be nimble, adjust course, and address things when we find that it's not working. And so, look, this is a time where leadership matters. And we've got some great leaders in this room, certainly within Hawaii Pacific Health, but outside of Hawaii Pacific Health. We need to be willing to stand up and lead, take the risk, and be willing to drive the change in our industry and in our community that we know is right, and not wait for somebody else to get us there.
Yeah. Mike, counsel to this room of leaders?
Yeah, I mean, you cannot put everything, when you're doing this kind of innovation, you cannot put everything in a contract. It's impossible. And it's debilitating, actually, to some degree. Mm-hmm. You have to have the trust and, as Ray says, leadership to get through issues. And that involves the ability to sit down and talk things through, just as in any relationship. You're all in relationships of some sort. And the ones that are successful, you can hash out tough issues. And it's not any different with this relationship. We will not agree on everything, but we will figure out a way to make it work because we have a common goal, a common purpose, and that's what this is going to take. And we have to work through the bumps and the barriers, just like in any relationship. And if you have to go back to a contract to solve every little thing, it's just not going to happen.
But doesn't it seem like, I mean, just to build on this for a little bit, I recognize, and I fully agree with the idea that leadership is critical, but it does seem like there are a lot of places where somebody can have a very successful career their entire professional life in healthcare as long as they keep their head down. And as long as they aren't brave or courageous and don't do anything to get noticed, they can be
Not
great.
within Hawaii Pacific Health.
Yeah?
That's a short career span.
Yeah? Do people self-select out?
Generally. What we generally try to do is make people so uncomfortable so quick that they leave before we have to ask them to leave.
Right on. I appreciate that.
But to Mike's point, he's absolutely right. And Mike, I hope I'm not oversharing here, but we just inked our most recent agreement between our two organizations, which I think if it were up to Mike and I, there would be no ink on the agreement. It would just be a relationship. But we just inked that. And we had a lot of people like Lori Luke and Jared Lividay and Melinda Ashton in our organization and David Okabe, all these folks who did a tremendous amount of work and similarly on the HMSA side, who worked for months and months and months to get to that point. And before the signatures were put on the document, Mike and I had a conversation and said, this isn't what's in the agreement. But let's just make sure you and I agree that this is the way we intend this agreement to come to life, and the spirit of the agreement, that it can no way be represented contractually. And if we agree on that, let's together echo that out to our organizations so that they understand that the agreement is just a framework that helps set the course for the direction we're going as partners to really bring in reform to Hawaii.
That is magic, right? That kind of trust.
And that conversation literally was probably one of the last things that happened before both parties signed the agreement.
So, Mike, how do you get that level of trust with other organizations? I know you have it to varying degrees with other organizations, but that sounds like pretty unique conversation.
I think it starts with, do you have agreement on what you see before you, and therefore what you need to do about it? And if you have agreement on what you think you need to do about it, then you can sit down and talk about how are you going to do that.
Yeah.
And we've had agreement on what's going on. We don't have that with every health system or every physician group, and it makes the conversation very difficult sometimes. We know what the people who are paying want. We know what the patients want.
It's how do you align all that? How do you bring it together? And for some, it's just a different, it's a bridge too far for some at the moment.
Yeah.
But whether it's some governmental agency who's going to drive that, or we'll do it ourselves, which we'd much prefer, we have to get there.
I got to tell you, I think I have the honor, thankfully, knock on wood, that I get to hear a lot of these kind of conversations with folks in different capacities and in different leadership styles, and I really think you guys both deserve a lot of praise for your individual and personal styles of leadership and the work that you have been able to do together and on behalf of your community. I think that you guys both really deserve a round of applause, so thank you for your participation.